rather large level of professional staffing, not professional, but staffing at various levels. One of the big issues here has been that most of this is done on contractual basis, short term. And then you also emphasize the need for long-term commitment. How do we square this circle? That for a long-term care of mentally ill, you need long-term institution of either community care or whatever care. But it has to be institutionalized bureaucracy or institutionalized service of care providers, which most of these programs are very, very short-term. So how do we plan for a person who's getting schizophrenia now, and will now need coverage for the next 60 years of his life? How do we plan that kind of service?
Well, I expected you to ask a very difficult question, and you have. I really don't have an answer, but I will share some of the thoughts that I have been having with other people. And very interestingly, the mental health resolution which was put up to the World Health Assembly this year and will be discussed as an action plan next year, talks about health and social care. And I think there the answer lies. And the resolution was sponsored by 3 countries. India was one of them. So Indian bureaucrats have certainly thought about this a little bit. And I think the answer lies in the integration not only of mental health into the healthcare, but integration of health and social care. And social care, the formal social care, but also the informal social care, which obviously is the biggest part. India doesn't have a real formal social welfare system. Mostly it's a very informal social care system. And I think we need to develop within the formal as well as the informal sectors the need for looking after chronic disabilities, which will include disabilities because of psychotic illnesses, but also because of old age and dementia, and also intellectual disabilities, which obviously will continue in spite of all the advancements which we have made. They will be disability for life, and that's the kind of planning that needs to be done. And social care system needs to be much more aware about the needs of these people, and incentives in terms of financial as well as in-kind support need to be built in there. The healthcare system will never be good enough to look after all the social needs and other needs of people who are disabled for a very long time. It is very difficult to think about health budgets covering that part, because health budgets will always be directed towards short-term gains. You're looking for quick benefits, and the health care providers as well as health policy makers will always look for that. It's the involvement of social care system that will really make the difference in planning for that. And there's a lesson to be learned from some of the European countries where the social welfare system is extremely well developed. They are finding it very difficult to manage within their very large budgets the social needs of disabled people. Almost 1/3 of all disability benefits are going into disabilities because of mental health. Chronic psychosis, depression, dementia, and other disabilities. And they are becoming much more conscious about how to really plan for the future. And India is not still in that state because we don't have a welfare system at all. But we have to really start thinking about that. And the answers will come from formal as well as informal social care system. Health systems need to really make the projections about what the needs will be. And to some extent, healthcare system can visualize what can be done from the healthcare system, which is not all that much. We cannot generate employment. We cannot generate, in spite of all the good attempts that we make, we cannot have tax benefits for people who are disabled. We cannot plan for long-term stays, although we do long-term stay for mentally ill people, but that demand will never be fulfilled from the health sector. We can demonstrate, but we cannot actually do it. So it has to be much wider discussion. And again, as I said, I don't have the answers, but the question is very valid.
Let me ask you a very global question. As a representative of a global organization,